Good day everyone, I'm Jarek Paul R. Mateo as BPED second year. So today we will discuss about blindness and low vision. But before we proceed to our topic, may I ask you first, what is your own opinion? What is the definition of blindness? Get your answers on the comment section down below. And if you are done answering, so let's proceed to our topic. According to our book, we have two general definitions of blindness or pagkabulag. So the first one is the legal definition, which is based on measurement of visual acuity, field of vision, and peripheral vision. So visual acuity is the ability to clearly distinguish forms or discriminate details at a specific distance. So normal visual acuity is measured by reading letters, numbers, and other symbols from a chart 20 feet away, just like when you're going to take the medical for your driving license. So there are some instances, or rather it is required to test a driver's vision if he or she is eligible to drive a vehicle. So the sizes of the letters in the chart correspond to the appropriate distances where they can read with normal vision. Thus, when a person can read the row of letters marked 20 out of 20 correctly, he or she has normal vision. His or her visual acuity is 20 out of 20, that is, he or she can read the letters that normal vision permits to be read 20 feet away when seated 20 feet away from the chart. So this chart is called Snellen chart, which is commonly used for this purpose. So on the other hand, if a person can read the row of letters marked 20 out of 70 only, when seated 20 feet away from the chart, his visual acuity is poor. So normally the larger letters can be read at a distance of 70 feet. Or when a person can read the rows of letters marked 20 out of 20 only, when seated 20 feet away from the chart, his visual acuity is so poor that it falls within the range of blindness or pagkabulag. However, there are people whose visual acuity in one eye is better than normal at 20 out of 10. This means that the better eye can see at 10 feet away what normally can be seen at 20 feet away. So for you to understand deeply what did I say, I researched a video about visual acuity and watch the video.
This is Sarah, registered nurse RN.com, and in this video I'm going to show you how to assess visual acuity using a Snellen chart. Whenever you do this, you are assessing cranial nerve 2, which is the optic nerve. And of course, whenever you perform this skill, you will need a Snellen chart. Now we're going to test visual acuity using a Snellen chart. And what you're going to do is you're going to have your patient stand about 20 feet from the chart. So Ben, if you'll stand about right there for me, and ask your patient, do you wear glasses?
No.
Okay, and if your patient does wear glasses, you'll want them to wear those for this test. Okay, so what we're gonna do, look at that chart over there and try to read the lowest line for me that you can read, okay? And first we're gonna cover your right eye, then your left eye, and then we'll do both eyes, okay? So cover your right eye. Okay, and what line can you read?
8.
Okay, read it for me.
D, E, F, P, O, T, E, C.
Okay, very good. Okay, now we're going to cover up your left eye and do the same thing. And again, whatever line you can read, let me know.
8.
8 again, okay.
D, E, F, P, O, T, E, C.
Okay, and now read with both eyes. And what line?
8.
Okay.
D E F P O T E C.
Okay, and he read from line 8, so that means that he has 20/20 vision. And this means that he can see the same line of letters at 20 feet that a person with normal vision can see at 20 feet. However, let's say that in his left eye, he could only read like line 6, which is 20/30. That would mean that his left eye sees at 20 feet that a person with normal vision would see at 30. Okay, so that is how you assess visual acuity using a Snellen chart.
That shows how to test a vision of a person using Snellen chart. So let's proceed for field of vision. So field of vision refers to the area that normally eyes cover above. So below and both sides when looking at an object or when gazing straight ahead of normal vision covers approximately a range of 180 degrees. So when looking directly at an object, the central field of vision is used. So peripheral vision covers the outer ranges of field vision. A person may have poor central vision but good peripheral vision. So tunnel vision results from an extremely restricted field of vision. It is like looking at an object in the environment through a narrow tube or a tunnel. So the field of vision can decrease slowly undetected among children and adults over a period of years. So a complete eye examination should include both visual acuity and field of vision. Again, I will show you a short clip on how to assess this field of vision. So watch the video. So next is legal blindness, which refers to the condition where visual acuity is 20 out of 200 in the better eye after the best possible correction with glasses or contact lenses. So the field of vision, whether central or peripheral, is limited to an area of 20 degrees or less from the normal 180 degree field. So a legally blind person with his or her eyeglasses or contact lenses can see or read only at 20 feet objects and letters that those with normal vision can see or read 200 feet away. So the person experiences difficulties in everyday activities, especially in discerning fine details of objects and things in the environment. So in other words, legal blindness, sila yung mga taong hindi totally bulag, pero nakakakita sila with the help of their glasses or contact lenses. In other words, yung mata mismo nila makakita pero blurry. Blurry yung mga objects na nakikita nila, kaya hindi nila madidetermine yung mga fine details ng isang objects or isang bagay. And let's proceed to the anatomy and physiology of the human eye. So the parts of the eye that we can see on the face are only a small part of the total mechanism of seeing. So the eye is a complex part of human body that no other organ can equal. So there are 5 physiological or physical systems in vision. Namely, number 1, we have the protective structures. Number 2, we have the refractive parts. Next is the muscles. Number 4 is the retina or the optic nerve. And lastly, for the number 5, we have the brain where vision takes place. I will show you a short clip about an anatomy of an eye which explains every single detail of this lesson.
Anatomy of eye. If we look at our eyes from the outside, the first thing we notice is that it blinks and the eyelids help the blinking to take place. However, what exactly is an eyelid? What receives the light energy? Which structure let us see at night? Let us take a closer look. The eyelid has 3 main functions. It protects the eyeball, opens and closes by voluntary or reflex action, and the blinking keeps surface of the eye and the conjunctiva moist. The eyelash are the short hair projecting from the border of the eyelid and traps large airborne particles. Conjunctiva is the thin epithelium covering surface of the eyeball, secretes mucus to lubricate, clean, and maintain moisture. Next comes the cornea, which is a transparent, curved layer that bends light to converge at lens. The aqueous humor is a transparent, watery liquid in the anterior cavity. It has 2 main functions. It is a medium for diffusion of oxygen and nutrients. Secondly, it refracts light and maintains shape of the eyeball. Iris is pigmented with color and has radial and circular muscles that regulate the amount of light entering the eye. The round hole at the center of the iris, through which light enters, is called a pupil. The lens is soft, transparent, and elastic in nature. It helps to focus light onto the retina. Suspensory ligaments hold the lens in place. Ciliary body is a muscle that is able to contract and relax. This contraction adjusts the focus strength of the lens when seeing near or distant objects. Vitreous humor is a transparent jelly-like substance at the rear of the eye. It refracts light and, together with aqueous humor, maintains the shape of the eyeball. The retina is the light-sensitive layer of the eye and bear photoreceptor cells called rods and cones. These cells convert electromagnetic waves from light energy to electrochemical signals that can be interpreted by the brain. These waves are transmitted via the optic nerve, which contains sensory nerves. Blind spot is the place where nerve fibers connecting rods and cones leaves the eye and has no photoreceptor cells. The process of seeing, in a nutshell, is mediated by the ability of cells in the retina to absorb light rays from objects that enter our eyes. Vision fields of both eyes overlap to form a stereoscopic, 3-dimensional vision, and the brain translates information from both eyes to form an image. The middle layer on top of the retina is called choroid. It has black pigments and prevents one internal refraction of light. Next comes the sclera, a tough, opaque, non-elastic layer on the outside of the eyeball and helps to maintain the shape of the eyeball. Eye muscle holds the eye in place. Lacrimal gland or tear gland secretes tears.
So now let's proceed on how vision takes place. So the basic function of the eye is to collect visual stimuli and information in the form of mechanical energy from the environment through the psychological process called sensation. So the eye has 10 tens of millions of electrical connections that are capable of handling as many as 1.5 million messages at the same time. During the process of vision, the stimuli are converted into electrochemical form or nerve impulses through the process of transduction. So the nerve impulses are described as the language form that our brain understands. So the optic nerve conveys the nerve impulses occipital lobe of the brain, where perception takes place in the form of visual images. So there are three conditions for vision to take place. First, the eyes are stimulated by light rays or illumination, which are in the form of mechanical energy. Second, the light rays are reflected from objects that are visual field. And lastly, the mechanical energy is converted into nerve impulses, which the brain processes into visual images. So the light rays pass through the cornea, then the aqueous humor chamber, then the pupil, the lens, and the vitreous humor. The light rays come to a clear focus on the retina. The optic nerve conducts the visual images to the brain, where perception of the visual experience takes place. So let's proceed now to the types and causes of problems of vision. So the inability of the eyes to function efficiently may be traced to: number 1, we have errors of refraction; number 2, imbalance of the eye muscles; and 3, disease; and lastly 4, trauma or accidents. So the error of refraction happens as light rays penetrate the cornea, aqueous humor, and pupil, and also the lens fails to refract or bend the light rays to reflect on the central portion of the eye. So the lens struggles to concentrate light rays from surrounding objects on the retina of hyperopia or far-sighted people. Since the eyes are so short from back to front, the point of focus lies behind the retina. So on the other hand, myopia or nearsightedness, the opposite takes place. So this time, the eyes are abnormally long from front to back, and the lens fails to refract the light rays from distant objects on the retina. So the point of focus falls in front of the retina. The eyes try to correct condition by making lens as flat as possible. To correct myopia, concave lenses are prescribed to diverge the light rays from far objects on the retina. In astigmatism, the cornea, which normally forms a portion of spherical lens, is deformed. The refraction of the light rays becomes faulty and blurred vision results. Astigmatism is corrected by use of cylindrical lens, which corrects the direction of the spherical lens. So next is the imbalance of the eye muscles. When the muscles of both eyes do not work together in a coordinated way, imbalance of the eye muscles occurs. In strabismus, different images are cast on each retina, resulting to cross-eyedness or squinting. Diplopia or double vision results when the brain cannot fuse the differences in the images cast on the retina into a single image. The condition can be corrected by prescription lenses, exercises, surgery, or a combination of the three. Amblyopia occurs when vision is suppressed in one eye and becomes weak or useless. Nystagmus is a condition in which there are rapid involuntary movements of the eyeball that can result to nausea and vomiting and dizziness. In some cases, nystagmus is a sign of brain malfunction or inner ear problems. So next is the diseases of the eye. So we have here cataract, diabetic retinopathy, and diseases of the retina, coloboma, retinitis pigmentosa, and glaucoma. So first, let us tackle the cataract. So it is caused by the clouding of the lens, which results to progressive blurring of vision and eventually blindness occurs. So the disease is associated with the aging process, but it can occur early among persons with diabetes mellitus. So children can suffer from congenital cataract. So some babies are born blind because of the congenital cataract. Cataracts can occur at any age because of the variety of cataracts. So it can be present at birth, although treatment for removal of cataract is widely available. So access barriers such as insurance coverage, treatment cost, patient choice, or lack of awareness prevent many people from receiving the proper treatment. So next is diabetic retinopathy. So diabetic retinopathy occurs when diabetes mellitus interferes with the flow of blood to the retina, causing to degenerate. Diseases of the cornea are the second leading causes of blindness in our country. So injuries and infections due to accidents and malnutrition sear the cornea, which shows as a whitish spread. So cornea scar is commonly called pilak. So diseases that destroy the cornea cause blindness. The cornea can be removed and changed with a healthy one through corneal transplantation. So next is the diseases of the retina. The most sensitive part of the visual mechanism can be congenital or present at birth. So many diseases are due to prenatal causes, that is, they occur during pregnancy. So next is coloboma. So it is a degenerative disease in which the central or the peripheral areas of the retina are not completely formed. So this results to impairment of the visual field and the central visual acuity and blindness. Next is the retinitis pigmentosa. So it is a hereditary condition that results in the degeneration of the retina. The field of vision becomes narrow and eventually results to blindness. So next is glaucoma. It is a condition where there is excessive pressure in the eye. So glaucoma is a group of diseases that can damage the eye's optic nerve and result in vision loss and blindness. So glaucoma occurs when the normal fluid pressure inside the eyes slowly rises. However, recent findings now show that glaucoma can occur with normal eye pressure. With early treatment, you can often protect your eyes against serious vision loss. So next is one of the causes of blindness or low vision because of trauma or accidents. So one example for this is a 24-year-old teacher usually goes in sleep in the minibus that he takes every day from his home to the school. So one afternoon, the minibus was bumped behind by a jeepney, shaking the passengers and bruising some of them. Unfortunately, the teacher, who was fast asleep, hit his head against the seat's wooden back. Then he complained of dizziness, severe headache, and blurring of vision. So after a thorough examination, the ophthalmologist diagnosed the condition as retinal detachment. Severe blow on the head traumatized the eyeball and caused the retina to break off from it. So the teacher became totally blind since then. So another traumatic accident involved a successful blind supervisor at the Department of Education. So she recalled how she lost her vision at the age of 7. So she was playing espadahan with friends when one of them hit her left eye with a wooden stick. The eye became infected and she suffered from monocular blindness in the left eye. Before long, the right eye sympathized with the left eye and the girl became totally blind. So next, let us tackle what is German measles or rubella. So German measles, also known as rubella, is a viral infection that causes a red rash on the body. Aside from the rash, people with German measles usually have a fever or swollen lymph nodes. The infection can spread from person to person through contact with droplets of an infected person's sneeze or cough, just like today, just like the pandemic, the COVID-19. It can spread through contact or the saliva. So this means that you can get German measles if you touch your mouth, nose, or eyes after touching someone that has droplets from an infected person on it. You may also get German measles by sharing food or drinks with someone who's infected. What are the signs of German measles, or what are the symptoms that you have a German measles or rubella? So the symptoms of German measles are often so mild that they are difficult to notice. When symptoms do occur, they usually develop within 2 or 3 weeks after the initial exposure to the virus. They often last about 3 to 7 days and may include: number 1, we have pink or red rash that begins on the face and then spreads downward to the rest of the body. Second, mild fever. It is usually under 102 degrees Fahrenheit. Next is swollen and tender lymph nodes, runny or stuffy nodes, headache, muscle pain, and inflamed or red eyes. So although these symptoms may not seem serious, you should contact your doctor if you suspect you have German measles. This is especially important if you're pregnant or believe you may be pregnant. So who should be immunized against rubella or German measles? First is all children aged between 12 and 15 months should be immunized with the measles, mumps, and rubella vaccine. Older children who have not previously been immunized against measles or have not bad measles diagnosed by a doctor should also have the vaccine. Next is girls aged between 10 to 16 years should be immunized with the rubella vaccine. It is recommended even for girls who have previously had rubella, unless they can produce evidence of immunity proven by a blood test. Next is women of childbearing age who have not previously been immunized. Next is women who are planning to become pregnant. It is wise to discuss the need for immunization with her doctor. Because having bad rubella or the rubella vaccine does not necessarily give lifelong immunity, a check on immunity should be carried out prior of women become pregnant, especially if it has been 10 years since receiving the vaccine. Women who receive the vaccination should ensure that they do not have or they do not become pregnant for 3 months. So rubella immunization should not be given to women who are already pregnant, women who may be pregnant or who may become pregnant within 3 months of receiving the vaccine, people suffering from fevers, serious diseases like cancer, and people taking cortisone-like or immune suppressive drugs. So before immunization, the doctor must be told about any chronic illness, infections or allergies, whether the person is taking medication or has received immunization within the past month. So that concludes my report for today's session. I hope you learned something and answer the following question I will posting here on our group chat. So again, I am Jerk Paul R. Mateo, BPED second year. So thank you for listening and watching. Once again, good day everyone, and stay safe and stay home.